Hello and welcome to this program today. My name is Dr. Rora Maranga, consultant gynecologist and cancer specialist at Janice Hospital in Nairobi. Today I want to talk about an important aspect, which is a question which I'm often asked: why do we have young people, young women, presenting at an increased rate, presenting with cancer, generally cancers? And this is why. There are many reasons, but we're going to address some of them. Some of the symptoms which would present are very, very common. A woman will usually present with very common symptoms which may not make her to think that it is something serious. The stressors of life. Young women are very busy with their lives. They have a lot of stresses, raising young families. There are also issues to do with the lifestyle, the lifestyle that one would lead in terms of diet, in terms of exercise, in terms of maybe smoking, in terms of alcohol intake. So nowadays we are having more and more people, and in this particular case, more and more young women presenting with their cancers. And when you look at diet, the type of diet that we have nowadays tend to encourage more of cancer development. You're looking at processed foods, processed starches, processed sugars, processed foods, generally speaking, fast foods, and a very high content of fats and healthy fats. This would usually predispose one to development of cancer, and that is why we would usually encourage, in terms of diet, want to go for whole meals, whole foods, whole grains, less of processed sugar, and less of processed meats. These are generally the unhealthy bits. And talking about still on lifestyle, we're talking about sedentary lifestyles, whereby we do less, women, and therefore society generally is doing less and less of exercises. The issue of boda, you find we rarely walk. You want to go somewhere, you order boda, or you find a boda, it takes you there and takes you back home, even for shorter and shorter distances. So as much as it has made our lives much more comfortable, it has also made us a bit more lazier, physically speaking. And therefore that is also contributing to obesity. And obesity is a high risk factor for development of cancer. The same thing with diet. When you talk about diet, the link is usually a high body mass index, which is obesity, which is a high risk factor for cancers. And the other lifestyle that contributes is excessive intake of alcohol. This would predispose to cancers, breast cancer, especially liver cancer also comes in. Smoking does predispose one to cervical cancer, apart from, of course, human papillomavirus. The other aspects are the lifestyles to do with having multiple sexual partners, or having a partner who has multiple sexual partners. That does predispose one to acquisition of human papillomavirus, or HPV, which is an important causative agent for cervical cancer. So looking at all this, you find our way of lives, young women especially, tending to develop cancers which ordinarily would have developed much, much later in life. Those are presenting much earlier. And which are these cancers we are talking about? We are talking about breast cancer, talking about ovarian cancer, uterine cancer, cervical cancer, all these are more common nowadays. And then for the bowels, we have also colorectal cancer, which has developed which is now developing much earlier. And generally, if you look at the number one type of cancer that is more commoner in young women is breast cancer. If you look at recent statistics, you find that even breast cancer is number one, and then followed by cervical cancer. And recent statistics are actually putting these two cancers as occurring almost by 70% or thereabout in women below the age of 50. And statistically speaking, below the age of 50 is considered younger women. And these are actually of great concern. And apart from that, there are other factors like environmental and genetic. For genetic, you may have there is a strong family history of some of these cancers within the family. Like for example, breast cancer, you may find first degree relatives, and these are like parents or siblings or even your own child or your own daughter developing some of these cancers. That would mean that there is a genetic link. Some of those genetic markers that or syndromes that you look at. Medically, we call them like BRCA1, BRCA2, but these are conditions which are genetic mutations or genetic changes which can be inherited, and they do predispose one to cancers. Especially when you talk about genetic cancers, we are talking mainly about breast cancer, about ovarian cancer, about uterine cancer and colon cancer. These are linked a lot, and they may run within families. Not all of them do run within families, but there's a higher likelihood that there could be some genetic link. Having said that, there are many factors which cause cancer, and it's not just the genes. You need environmental factors which will modify the genetic factors. Environmental, we have already talked about the diet, about the sedentary life. We've talked about lack of exercise, about human papillomavirus and sexual lifestyle, and exposure to other agents which may cause cancer, like ultraviolet rays, radiation, or even farm chemicals, which could now predispose one to developing some of those cancers. So yes, it is true that we are observing more and more cancers in young women, and this could be prevented by having lifestyle changes, being more active, doing more exercises, looking at your diet more keenly, reducing more of the processed foods and taking more of the whole grain foods, taking more of vegetables, a lot of fluids, a lot of fruits. These are healthy ways, and cutting off smoking, cutting off excessive alcohol consumption, and having generally a safer sexual lifestyle. This has been Dr. Rana Maranga, consultant gynecologist, cancer specialist at Janice Hospital. Remember to subscribe and also share. This information may assist somebody out there. Thank you.